Tell me about mastectomy. Tell me about taking out the breast, taking out part of the breast. You know, some ladies will feel like that takes away some of their feminine personality. Tell me about mastectomy, because I want to get into that, and one side, both sides, why, which, what.
So all women who are diagnosed by a biopsy typically are going to undergo some sort of surgical procedure. And we kind of lump them into two categories. One would be like a lumpectomy, where we remove the tumor in itself and all of the tissue around it. And then we actually can use a tracer that gets injected to the site where the tumor was, and then it will travel to the closest lymph node.
Oh, that's called a what?
A sentinel node.
Sentinel node biopsy. So you find out that would be under the arm from the breast, it drains up that way?
Wherever the tumor drains to, they will be able to find that first node that it lands on, remove that node, and maybe a node or two around it, and send those to see whether or not this tumor has metastasized or moved beyond just the breast tissue.
And the pathologist can tell you how aggressive, how mean, whether it's estrogen receptor, progesterone is what, just from the breast tumor or from the lymph nodes, or
well,
how does he know what to do?
From the breast tumor, but then too, whether or not that tumor has traveled to the lymph nodes, which tells us at what stage it is. And so that's very important in consideration, because typically most women, when they consult with a surgeon, have had some sort of imaging like a CT scan or an MRI, so they have a good idea about whether or not those lymph nodes might be positive, and the surgeon will then counsel the patient about what types of surgery might be best for her. So some women will prefer a smaller surgery, not removal of the whole breast, and doing a sentinel lymph node, and then leaving it in the surgeon's hands from there about what needs to be done.
Leave it in the surgeon's hand or the OB/GYN doctor's hand?
The surgeon.
The surgeon's hand.
The OB/GYN really is, my job is to help get women to the place where they're diagnosed, do their prevention, and then make sure that women that are at higher risk are being screened appropriately.